Hello, welcome back to the short eCourse in Cultural Awareness Guidance for Surgeons. I hope you enjoyed Module 1 on language. In that module, I spoke about the different language styles which people from different cultures use to communicate to others. Now, I'd like to present Module 2. As we learnt in Module 1, the UK is a multicultural society. It includes many people from different cultures. It's important, therefore, for surgeons to have some knowledge about other cultures and how they communicate. As well, cultural awareness is also becoming a mandatory part of your training. This module will help surgeons in this area. As we said in Module 1, culture shapes our attitudes, our experiences of life, and how we talk to each other. It also affects our beliefs on why we get sick and how we should treat our illnesses. So, it's good to have some knowledge of culture. Now, a brief recap on Module 1. Our language style is largely determined by our cultural background. Each culture has a preference for direct or indirect language. Each culture could be placed somewhere along the language continuum. It's important to be aware of this, so that if somebody speaks to you in a direct, abrupt manner, the underlying intention may not be one of offensiveness. It may merely indicate that person's cultural background. Equally, if someone speaks in such an indirect way that the message is lost in the words, that too may indicate a cultural preference. Underlying meanings within language, which may be different to or even at odds with the spoken words, are also culturally determined. It's important to be aware of this and to recognise and adapt to different language styles and cultural idiosyncrasies. Today, in this, the second of 3 modules, we're going to learn about politeness, or how to show consideration towards culturally different others. This module will take about 45 minutes to 1 hour to complete. You can stop the presentation at any time, pause, rewind, or come back later. As in Module 1, there are instructions, videos, guidance, and question and answer activities which you can download onto your computer. CPD points are also available after completing the module. Please note, there are no right or wrong answers to these questions or any issue concerning culture. Instead, the purpose of this eCourse is to encourage surgeons to begin thinking about this important topic. Politeness. Here are the learning objectives for Module 2. By the end of this module, you will know how politeness is conveyed, how cultures convey it differently, the 2 universal components of politeness, and how to adapt politeness for culturally different others. Politeness, or showing consideration for the other person, is conveyed differently according to cultural background. However, there are 2 universal components of politeness which occur in every culture. The first component is the ability to make the other person feel included, understood, appreciated, and valued. This is called inclusivity, sometimes called positive politeness. The second component is the ability to give consideration to the time, space, and world of the other with minimal imposition. This is called respect for non-imposition, sometimes called negative politeness. These 2 seemingly opposite and contradictory considerations should be attended to in all interactions. They can be embedded either in our verbal language or in our body language. They are the 2 universal components of politeness evident in every culture. Let's look at the first component, inclusivity, or the willingness to show that the other is included, appreciated, valued and liked. So, how do we do that? Verbally, we can do that by expressions of familiarity, warmth, thanks, cooperation or appreciation, by sharing information and tips, or by attending to the other, by agreeing or understanding their point of view and giving compliments or pleasing anecdotes. These are just some of the ways you may know others. But how do we show inclusivity in our body language? We can do this by smiling, being cheerful, using the right amount of eye contact, speaking in a pleasant tone of voice, having an open stance, inviting the other to sit down or offering food and drink, generally making the other feel comfortable. At the right time, physical touch to show empathy and understanding. You may know other ways we can use body language to show inclusivity. There will be a Word document for reflection on this at the end of the presentation. Now let's look at the second component, respect for non-imposition, or the willingness to consider the other person's time, space and world. Well, how can we do that? Verbally, we can do that by considering the other person's time constraints, their world, by giving them choice and or assistance, by offering something that will help them and checking back to see if that's okay, by not asking direct questions or putting undue pressure on them, by using their correct title, and by using indirect formal language if unsure. These are just some of the ways, and you may know others. And how can we show respect for non-imposition in our body language? Just some ways include not standing in someone's own physical space, allowing privacy, not speaking into a mobile phone during an interaction or looking at a computer screen, answering work emails, having a non-threatening voice and showing a calm and patient tone in your voice, having a facial expression which shows interest in the other, being punctual for appointments with others. These are just some of the ways, and you may know others. Here, the woman is trying to show inclusivity to the former Iranian president, but instead, she's invading his own personal space. She's not respecting the space or world of the Iranian president. In his culture, a woman, especially a Western woman, would not invade his personal space by shaking his hand without being invited to first. Even though these two components of politeness exist in every culture, different emphases are placed on them from culture to culture. For example, some cultures consider inclusivity more important for politeness than respect for non-imposition, while other cultures foreground respect for non-imposition over inclusivity, and so on. So it's important to be aware of this and to make sure to address both components in your interactions with culturally different others. Do you know which component is more important for politeness in your culture? Here are some possible surgical scenarios if politeness is not addressed. A trainer orders a trainee to do many tasks quickly. The trainee may feel overloaded, or he may feel as if he's not appreciated, or that his viewpoint is not important. Hostility may result, and relationships may be damaged, all because his trainer ignored the two components of politeness. Now, we're going to watch a video of a surgical scenario between a consultant and a trainee, where the consultant does not consider the two components of politeness, and the resultant interaction is not positive. Please read the scenario, and then I'll play the video.
Well, that was a disaster, wasn't it? Haven't you learned anything during your time on my unit? If I hadn't been there, that patient would have been a real mess.
I thought that was the way to do it. I mean, the registrar showed me, and I checked with the registrar.
I can't believe that's the way the registrar told you to do it. Didn't you attend my teaching session last month when I went through all the important points of the operation?
I did, and I even took notes. But I mean, the registrar, and this is my first time doing an appendectomy.
Well, get those notes out, because I want you to complete a procedure-based assessment. I want you to write down all the things you did wrong and put it online and send it to me, because I want to validate it by 6 o'clock this evening.
But I'm on cover and I have patients to see in the afternoon.
Well, that's not my problem. I have to leave by 6 o'clock because there's a squash match tonight. So just get it done.
Well, I mean, I guess I could get it done by 6 and just see my patients later in the evening.
Well, you better get it done, because if you don't, I'm going to notify your educational supervisor. Now, we've got a busy list. Get back out there and get the next patient ready. Sister, where's my tea and cake?
Let's look at the thoughts of the consultant during that video. He's probably thinking these thoughts while he speaks to that trainee.
This trainee has got so much to learn, he really isn't making much progress. He's lucky to have me as a trainer, as I can show him where he went wrong. He's probably so grateful for my help and instruction. Once he realises his mistakes and learns from them, he'll thank me.
Now, let's look at the thoughts of the trainee while he was talking to the consultant.
I feel terrible and I have lost my self-confidence. Those nurses could hear everything the consultant was saying about me. This is very humiliating. He did not listen to my account of the procedure. The registrar told me to do it this way. I don't like the supervisor. He's a bully. I am just a bad trainee surgeon. I might as well give up now.
Do these thoughts match the consultant's thoughts? Is there a link between those of the consultant and those of the trainee? No, there's not. Let's reflect on video 1. Does the consultant address either component of politeness? Why is the language of the consultant inappropriate? How could it be improved? Why is the trainee not responding? Please see the Word document at the end of this module for your reflective comments on these questions. Now, we're going to see another video, video 2. It's the same surgical scenario with the same consultant and the same trainee, but this time the consultant addresses politeness. In video 2, the consultant understands that his trainee comes from another culture. He knows that to transform a potentially difficult interaction around into a more positive one, he has to pay attention to the two components of politeness. He knows that if he focuses on these two components and embeds them into his verbal language and his body language, the trainee will more likely respond and learn from his mistakes. But how does he do that? While watching video 2, I'd like you to consider or think about how he does this. Please read the scenario and then I'll play video 2.
Hi.
Hello. Hi.
Ricardo, I'm going to have a coffee. Would you like one?
Yes, please.
Okay, I'll find the coffee. Do you want to grab the room next door and we'll have a chat about the operation?
Yeah, okay.
Okay.
Sure.
Okay, Ricardo, there's your coffee.
Thank you.
Now, do you want to go over what happened in the operation today, or would you like some time to think about it?
I mean, I thought that was the way to do it. The registrar showed me, and I checked with the registrar.
The registrar. Well, the registrar is very experienced and has done a lot of appendicectomies, but he does use a different technique from the one that I recommend, and I think my technique is safer, especially when there's unusual anatomy, like there was today. I know there's an awful lot to take in when you're actually doing an operation. Do you recall what I talked about when I did the demonstration of the laparoscopic appendicectomy in the skills lab the other week?
Yes, I did, and I took some notes of your demonstration.
Oh, that's great. Did you manage to understand everything in the demonstration? Or was there too much to absorb in one go?
Yes, I did understand most of it, I think. But the registrar, I mean, he said to do, and I mean, this is the first time I've done an appendicectomy.
Well, why don't you get out those notes? I could go through them with you if you like. I'm sure once we go through the steps of the procedure in detail, it will become easier to understand. Sometimes I forget that trainees have only just begun their training, and there's too much to take in one go.
Oh, that would be so helpful, Professor. I would really like that.
Great. But before we do that, I need to give you some objective feedback on your performance. It wasn't all bad. Some things were done well, and some things could have been done better. Can you remember what things you did well and what things you could do better?
Well, yes. I mean, I know there were a lot of mistakes. I was just just nervous in there. I just struggled to work out the anatomy, and then I just couldn't stop the bleeding.
Well, that's true, but it was probably because of the unusual anatomy. I did have to take over to control the bleeding, but that's my job as a trainer. I'm sure when we go through the steps of the procedure together, it'll be much clearer to you. Would you like to do that? Okay. Now, there were some things that you did during the operation that were good. Can you remember what they were?
I really can't remember. What were they?
Well, your port insertion and trocar insertion was a sound technique, and your initial inspection of the abdominal cavity was thorough. I did have to take over to control the bleeding from the mesocolon and mobilise the cecum, but once we'd done that, you transected the base of the appendix soundly and removed the specimen without much contamination. And your operation note was clear and honest. That was all good.
Oh, really? Thanks, Professor. I'm glad you think I did some things okay.
So let's identify a date when we can go over your notes and identify any errors you made today and how you could avoid them in the future. And then after we've done that, I'd like to supervise you doing another appendicectomy because I know you're capable of a better performance than you did today. Now, let's just have a look. I've got some time this Thursday. Would that be okay for you?
Oh no, sorry. I'm on call tomorrow until late night. How about the day after?
Well, the day after, I've got a clinic in the morning, but I'm free in the afternoon. Should be free about 3 o'clock. Could you come to my office then?
Yeah, sure.
Okay, and remember to bring your notes.
Okay. See you then, Professor.
All right.
Oh, and thank you.
Oh, you're welcome.
Let's look at the thoughts of the consultant during that interaction and see how they've improved from video 1.
This trainee seems unsure. I'll talk to him in a room with more privacy. I'll try to help him. I'll also discreetly check with the registrar about his teaching of this procedure. I want to let the trainee know that I understand the situation. It was the same for me when I was starting out. If I use inclusive language, I know he'll respond more positively. If I point out the good things he did in that procedure, maybe the trainee will be more receptive to learning about the parts he didn't do well. I want to show my trainee that I'm available for him and willing to assist him to learn. I'm glad I've changed a potentially negative interaction with this trainee into a more positive one. I feel this trainee does have potential in surgical procedures, and I want to bring that potential out and develop it.
Now, what about the thoughts of the trainee in video 2?
I'm so glad my supervisor took me into another room. Now the nurses won't be able to hear. That would be so humiliating for me. I feel better and more confident. He is listening to what I am saying. I feel he understands me and is trying to help me. I'm sure I will do better for my next appendicectomy. I want to improve my surgical skills now and show my trainer how I have improved.
Have they improved? You can see how the trainee's thoughts have improved when the consultant attends to politeness. Now, do they match the thoughts of the consultant in video 2? Is there a link between the thoughts of the consultant and those of the trainee? Yes, there is. I'd like you now to reflect on video 2. Why is the interaction better? Why is the trainee responding? And what is the evidence that the consultant is now culturally aware? Please write your reflective comments in the Word document at the end of this module after the presentation. Now, let's look at a comparison of politeness between the two videos. Let's look at some strategies of inclusivity. Did the consultant in either video use inclusive or friendly language? Did he show understanding or empathy? Did he try to lighten the mood? Did he give any compliments or say anything good about the trainee's recent surgical performance? Did he try to reduce the status difference between them? Let's have a look at a comparison. You can see the difference. In video 2, the consultant uses each of these strategies, while in video 1, he did not. Now let's break this down to some actual examples. In video 1, the consultant uses no friendly language. He reacts negatively to the trainee's mistakes. There's little understanding of the trainee's position, and he doesn't even try to assist him. As a consultant, he's using a power over position, creating distance between himself and the trainee. And he offers no friendly or helpful information. By contrast, in video 2, the consultant uses many strategies of inclusivity. Here are some examples. He uses first-person pronoun to create feelings of inclusivity such as we, our, us. His language is friendly and positive. Importantly, he conveys understanding and even empathy, as well as a belief in the trainee's ability. The consultant's language is clear and simple, and he shares information with the trainee. Here are some further examples. In video 1, there's no empathy in the language, or compliments or saying any positive things about the trainee's surgical skills. He isn't cheerful, or he doesn't even try to build up a relationship with the trainee. And there's no expression of his own vulnerabilities. By contrast, in video 2, the consultant makes the trainee feel appreciated. He gives the impression he's working with the trainee as part of a team, rather than the trainee working for him. He tries to lighten the mood. He interacts with the trainee and uses language that he would understand. He gives a compliment or two about his recent surgical performance. And he also lets the trainee know about his own difficulties when he was a trainee. This admission of vulnerability creates understanding and closer ties between them. And he even assists the trainee by offering him an extra lesson. All of these strategies used by the consultant develop the trainee's confidence in his own surgical ability. And they also create feelings of inclusivity. This leads to a more successful learning environment. But what about the body language in the two videos? You can see in video 1 examples of bad body language. The consultant does not smile, his eye contact is intrusive, and he even points his finger at the trainee. His voice is loud with an unfriendly, even at times aggressive tone. He's impatient with an angry facial expression, and often his body language is confronting. By contrast, in video 2, the consultant smiles. He uses the right amount of eye contact and speaks in a friendly way. His tone of voice is understanding, and his speech is slow and clear. He offers the trainee some coffee and even brings 2 chairs together for a relaxed discussion. These strategies create feelings of inclusivity for the trainee. What is the overall effect on the learning of the trainee? In video 1, the trainee feels alone, not listened to, not consulted, or even understood. He's not happy, as he feels unimportant and that his own knowledge is not worth much, so his self-confidence is diminished. By contrast, in video 2, because of the strategies of inclusivity, the trainee feels listened to, understood, and assisted. He feels his own knowledge is important, so his confidence is boosted. He's now enthusiastic to learn and feels comfortable in this interaction. The resultant effect is that now he's more likely to learn and improve his surgical skills. Remember what we said at the beginning of this module. Each culture considers one component more important than the other. Have you decided which one is more important for politeness in your culture? Now, let's look at a comparison of the second component of politeness, respect for non-imposition. How was this done in the videos? Did the consultant respect the trainee's work and world? Did he give a choice to the trainee? Did he offer any help? Did he try to protect the reputation or face of either the trainee or the registrar? Did he show patience and give assistance? Did he avoid confronting language? Let's look at a comparison. In video 1, it's no wonder the trainee is not learning from his mistakes. What about some actual examples in the dialogue? Let's look at these. In video 1, the consultant shows no interest in the trainee's world, no understanding of his time constraints. He gives no choice, no offers of assistance, and no checking back for the trainee's thoughts or approval. By contrast, in video 2, the consultant asks after the trainee's world because he's genuinely interested. He seeks the trainee's approval. He also chooses his words carefully and gives the trainee a choice of dates for the next meeting. As well, the consultant consults and checks back with the trainee if that time's okay. He gives the trainee a chance to explain his side of events and even, if he wants, a private surgical lesson. Here are some further examples. In video 1, the consultant, through his direct language, damages the face of the trainee as well as that of the absent registrar. He insinuates that the registrar's method of teaching the procedure is wrong, without knowing the full story. This consultant also displays impatience and intolerance towards the trainee, and he certainly does not consult him. By contrast, the consultant in video 2 makes an effort to protect the reputation of the registrar. He does not know the full story and so makes allowances for his absent colleague, until such time as he has all the facts and can make a better judgment. He's respecting the absent registrar. He also displays patience and tolerance with the trainee for his apparent mistakes. He even asks the trainee about his own opinions about certain matters. That was verbally. Now what about body language? Let's look at some examples of bad body language in video 1 which do not show respect for the trainee's work, world or person. The consultant reprimands the trainee in front of the nurses in the common room. He stands over the trainee, even in his own physical space. Speaks to him in a loud, threatening voice, even pointing his finger. He offers no food or drink or any comfort. By contrast, in video 2, the consultant offers so much. A private room to chat, not speaking into his phone during discussions, instead giving the trainee adequate personal space, time to reflect, and a chance to explain. He also gives him a chair and some coffee. By doing so, the consultant creates a relaxed atmosphere, which is all good for learning. So what effect does all of this have on the trainee and his learning? In video 1, the trainee feels humiliated, even bullied. He feels unsure and even pressured. He's afraid of this consultant and he feels like giving up. Not a good environment for learning, I'm sure. In video 2, the trainee feels that the consultant is interested in him, that he's being consulted, and that he's not being rushed and that minimal pressure is put on him. He feels no shame or loss of face, even with his recent surgical mistakes. His anxiety is reduced. Importantly, that he's an integral part of the surgical team and that he wants to improve his surgical ability. Here, learning can more easily take place. The trainee wants to learn and improve his surgical skills. Now, let's recap on what we've learnt so far. The two universal components of politeness are inclusivity and respect for non-imposition. They can be embedded in our verbal language as well as in our body language. They occur in every culture. Some cultures consider one more important for politeness than the other. For example, in the English culture, respect for non-imposition is considered more important for politeness than inclusivity. I wonder about your culture. To consider, as we said, some cultures foreground one component over the other. Therefore, when speaking with culturally different people, be sure to address both components. That way, there's more chance that face or reputation is protected and offence is less likely to happen. Lastly, as a good general rule, always include both components in all encounters with others. Upon completion of this presentation on Module 2, there's a link to these Word documents which you can download onto your computer. Questions and reflections on videos 1 and 2, further analysis, a cultural competence table, and some advice and tips. Please remember, there are no right or wrong answers on politeness. These documents are intended to get surgeons thinking about this important topic. Let's recap on the learning objectives we set out at the beginning. Now we have learnt how politeness is conveyed, how cultures convey it differently, the two universal components of politeness, and how to adapt politeness for culturally different others. Well done! You have now completed Module 2. Coming up, in the final module in the Cultural Awareness Guidance, Power and Status. In this module, I'll be talking about how some cultures react differently to power and status, and what we can do as surgeons to deal with these differences in positive ways. Thank you for completing Module 2. I hope you enjoyed it.